everyone, and welcome. Public Health Ontario, in collaboration with the Institute for Pandemics at the Dalla School of Public Health, University of Toronto, is hosting a rounds presentation on gaming and pandemics, agile analysis in a time of crisis. My name is Yasmin Khan, and I'm a physician lead at Public Health Ontario, and I have the pleasure of moderating today's session. As we begin today's session, we wish to acknowledge the lands and waters of the traditional, unceded, and treaty Indigenous territories on which Public Health Ontario operates. We respect and appreciate Ontario is now home to many diverse First Nations, Inuit, Métis, and urban Indigenous peoples and cultures. We are grateful to have the opportunity to work on this land for the mutual benefit of all. Before we begin with today's presentation, I'll mention a few housekeeping items. The chat pod has been disabled to limit any distractions during the presentation. Please use the Q&A pod if you have questions during the session. A discussion and question period will follow the presentation. If at any point during the session you experience any technical issues, please email capacitybuilding@oahpp.ca. And I would like to state that as the moderator of the session, I do not have any potential conflicts of interest to declare. And it's now my pleasure to introduce the speakers for today's presentation, Dr. Ben Taylor and Dr. Rex Brynan. Dr. Taylor is a Senior Operations Research Analyst at Defence Research and Development Canada. He has worked as an analyst in both Canadian and British governments supporting longer-term planning of national military forces and has taken part in many North Atlantic Treaty Organization and Five Eyes studies. In recent years, he has led efforts to introduce war games into force development work in Canada. During 2020 to 2021, he developed games to explore policymaking by governments facing pandemics. Dr. Taylor has a BSc in Combined Studies and a PhD in Chemistry, both from the University of Leicester in the UK, and is accredited as a Fellow of the Operations Research Society. Dr. Brynan is Professor of Political Science at McGill University. In addition to his other areas of research, which include Middle East politics, security and development, peace and humanitarian operations, he teaches and writes about serious games and is senior editor of the conflict simulation website PackSims. He was part of the team that developed the Outbreak Ready infectious disease simulation and currently serves as a member of the World Health Organization Global Outbreak and Response Network Working Group on Gamification. Okay, and now I'll turn it over to Dr. Brynan.
Thank you very much for that introduction, and thank you all of you for being here today. As you all already heard, neither Ben nor myself have a public health background. We have backgrounds in very different things, but that soon changed when the pandemic hit and we were asked to support efforts by the Public Health Agency of Canada to roll out the COVID-19 vaccine. So what we'll be doing is we'll be talking a little bit about that process and how it worked and how we thought it was quite useful. As you will have already heard in the introduction, I'm a political scientist at McGill University. Amongst the many things I work on, one of the things I increasingly work on, it's probably my primary thing now, is the use of serious games, both for education and training purposes and for policy analysis. And I've designed games around humanitarian response, around infectious disease outbreak response in the humanitarian sector. I'm working with WHO GORN right now on gamification of training. And I've done other stuff on biosecurity, notably with Agriculture Canada on African swine fever. So those kinds of things you see are the kinds of things I do, and they range from digital games on the left to manual games on the bottom. Ben, who are you?
So good afternoon. I am indeed Ben Taylor, and thank you, Yasmin, for the introduction. And as we've already discussed, I'm an operations research analyst, so somebody who tackles problems to try and advise planners. And my career has been in the defence sector, initially in industry, and then the UK government, and for the last 15 years in Canada. But I'm an analyst who uses games as a tool to help sort of explore problems. And this clearly is one sort of particularly impressive problem we've had to deal with in the last few years. the relationship, the drift to perhaps from sort of true defense work into pandemic work came for me through a pilot project run at Global Affairs Canada, who were looking at a potential flu pandemic in 2018-19 as a sort of proof of concept of how to use a serious game to help stimulate discussions within government. And following on from that, I've been doing a little bit of work with the Faculty of Health Sciences at Simon Fraser University, supporting the team there, teaching an undergraduate course in pandemic management, and now a funded project on pandemics and borders has been sort of one of my sort of current activities. Next slide, please. And here's a few graphics showing some of the things I've been working on. We have, with the Simon Fraser team, created our little fictional continent with countries which we can inflict various sort of misfortunes onto, and have players try and manage these economies through various sort of data entry forms to select policies, noting in the top right the idea of interlinked components, that sort of the health response to the pandemic has impact on society, has impact on economics, and it's that sort of holistic management of policy, which is the area which we've, both Rex and I have been trying to look at. So next slide, please. So back in late 2020, the Canadian Armed Forces personnel, a planning team for the Canadian Armed Forces were assigned to work with Public Health Agency of Canada to providing support to the planning for the task force. This organization was called the Vaccine Rollout Task Force. They were rapidly sort of organizing themselves in November 2020, and somebody had the idea, why don't we wargame the vaccine rollout? They weren't sure what they wanted that to be. We didn't, but it's a standard part of military planning to establish a plan and then to do some kind of game to test, to run through, to sort of rehearse before you actually execute a plan. So it's a standard part of military planning practices, and they said, okay, let's wargame the plan. Next slide, please. So wargaming, because clearly here is a common tool, as I've just said, using a game to put somebody in an environment where they can rehearse something, practice something, without actually getting real troops in the field, without actually using any real equipment, but exploring choices and interaction by one team working to do something, another team perhaps working against them, creates friction, but also can create insight. And wargaming can be demonstrated as an approach. Serious games can be seen as an approach that can generate real, genuine insight to a problem much better than a sort of static walkthrough or a review of sort of things like PowerPoint slides. Red teaming, as we also described here, again, is a commonly used technique in different environments, particularly within government and elsewhere. And it really means establishing an independent group to look at a plan, to identify possible weaknesses in the plan, opportunities to adapt the plan. But it's always coming from that sort of challenge that it's very, very hard to be critical of your own work. There's a quote from Thomas Schelling: nobody, no matter how clever they are, can possibly write a list of the things that wouldn't occur to them. Well, the great thing about a red team is sometimes things occur to them that didn't occur to you, and sometimes those points are very powerful. Next slide. So when approaching this exercise, we applied rule number 1, do no harm. We recognize as researchers that the worst thing we can do is interrupt the people trying to roll out the vaccine, to invite them to come to lots of meetings and workshops, to ask them what their pressure, what they were currently trying to do. The response probably being, we're trying to roll out a vaccine and you're asking us lots of questions. We needed to come up with a mechanism to engage them where we had to, because after all, they are the planners. It is their plan and they are responsible for delivering this vaccine rollout plan. But we didn't, but to do so in a way that created minimal possible interruption to the work they were doing. So our approach was really to use non-Public Health Agency of Canada subject matter experts, SMEs, wherever possible, drawing them from elsewhere in government, academia, and as well as retired officials. So we could bring expertise to bear without touching upon the people who were really working the real problem. We also recognized that given the very tight timescales, everything would have to be done through structured judgment sessions. There was no opportunity to build mathematical models, simulations that would just not be possible. And given where we were at the time in November 2020, everything had to be virtual and run online. Next slide. So for the general architecture, we essentially have a 3-step process. Firstly, you bring your red team in to look at the distribution plan, and that red team then comes up with contingencies or things that might happen, things that could go wrong with the team. You then bring the planners in for the one time you engage with them directly to say, to present them with these contingencies, to have them discuss it, to have them develop mitigating courses of action. If this happened, what would we do? We then thanked them for that and took those insights, but then moved to a second meeting of a red team. And in this case, we're showing them here the contingencies, we're showing them proposed mitigations, and we asked the red team asking the red team again to compare the two and really discuss the residual risks. In other words, would the mitigations be effective, wholly or in part, at mitigating the contingencies, or were there still some issues that would have to be flagged and would remain significant risks? You'll notice the timeline was very, very tight. The whole process been run from the first meetings, 23rd, 26th November, through to the independent red team on the 11th of December, the second meeting. So this was a very, very swift run through with a large number of people, but a very fairly straightforward and simple structure. Next slide, please.
So let me talk a little bit about the red teaming. We established the red teaming using sort of our existing professional networks, as well as suggestions from Public Health Agency of Canada. And as Ben has already said, that was retired senior public servants, police officer, military, academic healthcare experts, foreign service officers, because some of this had a diplomatic component to it, researchers in social media, misinformation, risk communications and community engagement, and so forth. And we set up, in fact, the first red team meetings. There were 4 of them. Each had about 8 to 10 members of the red team. Some of those were in more than one session, some of them switched. And we took them through what in the Vaccine Rollout Task Force were the 4 phases of the plan. The procurement of the vaccine and their initial arrival in Canada, distribution of vaccines to the provinces and territories, ramping up vaccine administration as the flow through became greater, and then eventually transition to steady state. So we went through each of these phases with a red team session of about an hour and a half, 2 hours, and we simply asked our participants to say, okay, we're going to brief you on the plan as it stands right now, and we're going to ask you, based on your experience and expertise, to come up with things that might go wrong. And so we were very much focused on listing long lists of things that might happen. Some of them were endogenous to the plan. Some of them were exogenous. What happens if weather or an Icelandic volcano eruption, that was one of my favorites, interrupts the air transit and prevents stuff from being flown in? What happens if the US won't allow vaccine to be shipped out of Chattanooga, which is what happened, and so forth. So we came up with long lists of things that might go wrong. We then just set about building a much larger tabletop exercise with much larger number of participants. And we drew from that big list of things that might go wrong, a smaller list of things that we were going to use in the tabletop exercise. This was a balance of the things that we thought were the most likely to go wrong and the things that would be most disruptive if they did go wrong. We couldn't put every contingency that had been identified by the red team in the tabletop exercise because there simply wouldn't have been enough time. We could get about 8 to 12 problems in a full day session. So we had a full day session, a full day tabletop exercise divided into 4 sessions. Vaccine Rollout Task Force, Public Health Agency Canada developed a participant list from across the federal government, the provincial government, and territorial government. Now, we as the organizers were told to expect about 40 people. That number went up and up and up and up and up, and we ultimately had 150 registrants from 8 federal departments and agencies, all 10 provinces, 3 territories, and the Canadian Red Cross, all spread over 6 time zones. And each session of the 4 sessions that made up the day had 2 to 3 contingencies for the players to respond to. Each of those 4 sessions, like we had done with the red team, looked at a different phase of the plan. So they were sort of temporal slices of the overall pie. Some participants were there for the full day. Some were there only for parts. So we had to make it so that each session was a bit self-contained, knowing that people would shift in and shift out based on their interest and availability. Participants were assigned to one of 4 breakout rooms. So we give them the scenario, the situations, the problems that had been encountered. They go to breakout rooms. They think about what they would do to try and deal with those contingencies if they emerged, and they would come back and brief the main session. And we had Public Health Agency of Canada staff to facilitate and record the discussion, and Canadian Forces staff to help with the recording in each session. All of this was done over WebEx, so using sort of well-established techniques for online meetings that we're all familiar with. And we had very senior facilitators and observers who were able to move through the rooms as the discussion was underway.
Okay, thank you, Rex. So here's the sort of the blueprint for each of these 4 sort of mini sessions through the day. And as we've said, they had to be self-contained because we could always have new people coming to each session. So a 15-minute brief to explain the concepts, the sort of rules of engagement, what we're trying to do, and provide the context to the plan. But then we broke the participants into 4 different working groups, deliberately designed to have different participants to try and stimulate different discussions. So in room 1 was entirely health agency staff, in fact, so they were the planners. They could talk to themselves about their own plan. But we also had a room containing people from other federal departments and agencies to have the discussion about what they think ought to be done under the circumstances. We had another room which was strictly provincial and territorial health ministry personnel. And then we had a mixed group with people drawn from all sorts of different locations and backgrounds working together. So these allowed us to have 4 parallel discussions around exactly the same material, hopefully producing a richer variety of perspective coming out. And again, as Rex has said, we preceded these groups with scribes and with sort of chairs and facilitators, so we didn't have that sort of awkward silence where everybody wants to know who's going to volunteer to be the note taker. We had that set up, that was imposed, so people, all they had to do is go in there and will be guided through a discussion of the topic in hand. At the closure of those 45 minutes, there was then a 30-minute sort of closeout space that allowed each of these groups to brief back sort of in about 5 minutes, sort of the key ideas and the findings that they had, and then a quick sort of Q&A and wrap up. So the whole thing was fitted into a quite strict sort of 90-minute block. And in fact, we managed through the day to run 4 of these, and all of them ran to time and worked as planned. Next slide, please. So here's an example of some of the material we were giving people. Rather than having sort of dry text descriptions, we just made up sort of these sort of like fake sort of news broadcasts, news headlines to give examples. So among them, there are things like the central one here: Belgium probes the vaccine death. So an example being that sort of in a European country, there are people have died, and there are sort of social media reporting saying it's in reaction to a vaccine. So what's the response to that? We have bottom left, what happens if the United States says all vaccines made in the United States are for American arms only and foreigners can have to wait? So that was a risk we identified, which may or may not have actually happened. And all various sort of issues trying to provoke a sort of look at the provincial to federal level. What happens if provinces think that sort of they're not getting their fair share and they ought to get a different allocation of vaccines from the federal government? So a number of different issues, quite varied in their nature. And these sort of examples of the things that we were building up and providing to the players to work with. Next slide, please. So we then moved on, having completed those exercises, we then sort of drew breath for a few days and then brought the red team back again the week after. Mostly, many of them the same. A few swapped in and out. Some were just unavailable, but we got another strong team back together again. And they were asked to look at the likelihood and severity of each contingency before and after the mitigations. So I've given the examples from the previous slide. If that happened, what would the consequences be for public opinion, for the ability of the time, the risk to the rollout of the vaccines and these kinds of criteria? And then once the planners had had a look at it from the TTX and had actually said, well, if this happens, then we would do X. Or, well, it wouldn't happen anyway because we already have a policy of this, which means it can't happen. So they would present the mitigations, and then the participants were essentially asked to say, well, is this still a risk? Is this still a problem? We provided some standardized sort of word ladders and scales to allow people to sort of pin what they were saying in terms of key words that sort of indicate a level of confidence or probability. So it was it was a rapid exercise to go through all of these with the group, and we allowed them, we wanted everybody in the red team to express their own view. So we're using electronic polling tools like the one we used at the beginning of this presentation. So we got everybody's perspectives on every question, rather than letting the room debate and discuss and try and sort of synthesize and come to consensus. But we pulled all that data together, tabulated it, and then sent the whole thing back into FAC, where the next step took place. Next slide.
Okay, so we've discussed what we did. Took the plan, had the red team try to find holes in it, problems with it, took some of those problems, ran through a day-long tabletop exercise with federal and provincial officials, then took the kinds of mitigations that they had identified and went back to the red team and said, do you think this would actually mitigate it of the problem? So that's what we did, but was it useful? So I mean, that's the real question here. So certainly the holding of the game met the federal government's requirement to, in an outward-looking sense, to show the public that it was actually doing something. So the day after the TTX was held, there was a national press briefing in which it was talked about extensively. The report of the TTX and the other work we did, the red teaming and the residual red teaming, that was briefed to the FAC leadership, and then it was briefed to the Prime Minister. So the outcome of the whole process was briefed to the Prime Minister and members of the federal cabinet. And then there was a follow-up. The vice chair of the federal COVID committee came back and said, that's really interesting, could you talk about it some more? So there was a further discussion at the cabinet level on what we had found and what our own senses was from the TTX. So
we're also holding simulation tests. The distribution to test the distribution plan in consultation with all partners, stakeholders, through a series of tabletop exercises and rehearsals, one of which occurred yesterday. This is to ensure that critical capability gaps are filled, the risks are mitigated and well identified, that the plan is resilient, contingencies are put in place, and it's the start of the dialogue with a number of interactors. In short, our plan is to secure movement of the vaccine supply chain from manufacturer to each of those individuals, each individual that will be immunized by a licensed healthcare provider in Canada. So we're very much collaborating at an unprecedented level with stakeholders and partners to plan and execute a timely, fair, well-synchronized distribution of vaccines to all Canadians.
So it's one thing, of course, to have a press conference saying we did a tabletop exercise and it was useful, and even to brief it up to cabinet. But was it actually useful? Well, we think that it was. We're slightly biased, perhaps, but we think that it was. At fact, the risk assessment process was found to mesh very well with particularly the Privy Council Office's view of how risk should be assessed in public policy. And that encouraged FAC to formalize an internal process for risk-based analysis around COVID-19 vaccine rollout and related issues, which has continued till present. So there was in some internal reorganization to be able to do this kind of not exactly the same, but to undertake this kind of process in an ongoing way in support of the vaccine rollout. The tabletop exercise enabled a nationwide dialogue amongst public health officials on vaccine challenges, which had not been one of our purposes. It was why our participant list had gone from 40 to 150, because there were simply a lot of people at that point in the provinces and territories who wanted to hear more and have more discussion with federal counterparts on how the plan was shaping up. And public health officials were immunized in a way by pre-exposure to contingencies and challenges. That is to say, when things began to go wrong during the rollout, many of those had already been identified, and there had already been discussion of, if this starts to happen, we could do X or we could do Y in response. So I won't read through these long quotes here. I'll just sort of pick out the highlights. But Ben and I have went back later to those who'd been involved in the vaccine rollout at the federal level and asked whether it was useful. And the feedback was very positive. Here we have a FAC official saying that because we had a really solid discussion at the red team level and worked through it in the TTX, we'd already thought about these kinds of stuff in advance. Had we not done it in a controlled fashion before the doses hit the ground, when it began to get muddy, had we not done all that, I think we would have been in a much more challenging space. So having rehearsed it and thought through what could go wrong and working out mitigations for that in advance, this particular person thought was useful. Here, one of the Canadian Forces planners who was assigned to the task force said the red teaming portion was greatly appreciated. Everyone liked that, not because of any specific revelation, but because it seemed a good vector check by outside agents. And remember that the red teaming was done by people outside the planning process for the most part. This is a good way to assure that we're not falling for some sort of confirmation bias. That was appreciated by a lot of the seniors. Public Health Agency of Canada official saying that they didn't have to kind of go through those stages of grief when the plan began to fall apart or wasn't working according to plan, because they'd already seen that risks could come. And then as we hit the risks, it's like, crap, well, there it is. We talked about it. Now let's move on and do something about it. And in that sense, it was invaluable. Also, feedback from Public Health Agency of Canada more than a year afterwards. We gave them, through the tabletop exercise and the planning and the documents, an opportunity to have those kinds of discussions that they'd never had before, and then trickling down from that. What we've seen has been very interesting. A number of people who commented on it, the level of collaboration that was spurred by having worked through these kinds of contingencies and challenges collectively. We did go, and I've got these slides in a bigger form where you can actually read them. We did go and do post-event surveys 1 month after the process and 1 year after the process. The numbers are very good. The response rates are very low. So that's why I'm not going to share it. Nothing particularly asks me to go through the slides. But to the extent that we could get feedback from those who'd been involved, quantitative feedback, that was very positive. And the qualitative feedback has all been very positive.
Well, upon reflection, we were at a difficult time in November 2020. Canada was late in beginning to deploy vaccines compared to some other countries, but the graphics still show that we caught up very, very quickly and ended up with one of the leading providers of vaccines, first and second rounds, compared to many others. So, in essence, we took it at a time when there was struggle. We showed that the government could show that it was taking it seriously, and the subsequent scheme has been pretty effective. We found that nearly everything that we did. Everything that happened was really a representative of something we had covered in the TTX. The one difference is nobody in the red teams identified the idea of the variants of interest. The fact that the virus could mutate and possibly escape the vaccines was not a risk that had been identified. But you also did identify a number of risks that didn't manifest to any significant degree. We were very concerned initially with the Pfizer low temperature, ultra low temperature distribution and storage, whether that would break down at some point, leaving wastage and loss. Direct action by anti-vaccine groups to try and interdict deliveries, protests of occupations and so on, or sort of criminal or other sort of attacks on the healthcare system, or even the black market being created. So these were identified as potential risks that we looked at, but didn't actually sort of really manifest. Next slide, please. So in terms of lessons for analysts, it was a fascinating thing to do. And you have this paradox. You have to go fast. You have to be flexible, and you have to engage at senior level. And generally engaging at senior levels, can we review that? Can we have a meeting? I can't make a decision today. So we had to move in a sort of fairly dynamic fashion, informally across networks. Rex and I had no formal relationship. We happened to know each other and happened to work in overlapping areas. So we engaged ourselves, but my organization followed along and supported sort of after the fact almost. So this is the challenge here is having senior leadership endorse this, let us do this, but not actually to step in the way. And it worked. It was very successful. And the team sort of delivering, again, sort of everybody gelled, no matter where your background is, people just delivered. the questions it leaves for people looking forward. How do you promote informality in hierarchical sort of bureaucratic organizations? And how do you take advantage of people such as retired officials, retired military officers, who can be immensely valuable, knowledgeable individuals? They're no longer in the system. They don't have the sort of maybe some of the reticence to talk that somebody whose job it is might do. And so making sure you can tap into that expertise is something that definitely needs to be sort of pursued, and to make sure we do this at every opportunity. Next slide. There we go.
So we could throw up, I'm just going to add a couple of points which really reiterate things that Ben just said in terms of lessons learned. One is not addressing variants of concern might seem strange, but keep in mind, we were testing logistics. We weren't asked to predict how the pandemic would develop. We were asked to explore what could go wrong in getting vaccines to Canada, getting them to the provinces and distribution. So it wasn't a red teaming and TTX process about the pandemic writ large. It was very much in support of the logistics plan. That network flexibility issue is key. I will praise Ben's organization. DRDC had a whole bunch of people working on this, most notably Ben, but others too, about 10 days before the memo ever came asking them to work on it. You know, by the time it took a memo to go from the Vaccine Rollout Task Force across over down to Ben's desk, everyone was working on it, and that was terrific. There were other parts of the federal government that wouldn't do anything until the memo arrived and ended up not actually contributing as much as they might have. And I just want to reiterate his point about retired seniors, that the value of having someone who's been doing this in government for decades, who is now retired, who knows where all the skeletons are, who knows what doesn't work very well, who knows where the agency falls down, who is desperate to help, who is really committed to trying to make this all work and has spare time and the ability to be completely honest, was just terrific. We got absolutely invaluable stuff out of retired civil servants, retired RCMP officers, retired military medics, doctors, and so forth. It was just outstanding. And that was one of my real takeaways, is that this is a really untapped resource for contingency planning and red teaming and so forth. So anyway, we'll throw it open for questions at that point.
Thank you so much, Drs. Taylor and Brynan, for this fascinating presentation. So we'll now move to the Q&A pod to address some of the questions on your presentation. So for the audience, please continue to enter your questions into that Q&A pod if you haven't already had the opportunity to do so. And I guess so. I'll just turn to the first question, and perhaps very on topic with your last remarks on related to contributions of formerly retired people to the pandemic. We have a question from how much did politics rather than science influence the exercises? And if a lot, how can the influence of politics be mitigated?
Okay, I'll have a stab at that, and Ben can follow up with anything he wants to add. Politics had virtually no impact on the process. We weren't given any political instructions. To some extent, this was all happening so fast that no one had any time to get political about it. So we had relatively free reign. There was one of the contingencies, there was a little nervousness about if this contingency is used in the TTX and it leaks to the press, will it, will the headline read Canadian government planning for X? They said, should you really touch that one? It's a really sensitive political issue. And we said, yeah, it might happen. We don't think we should exclude it. It did happen to a little degree. And they said, okay, you're right. So there was one slight pushback that really wasn't a pushback. There was a concern, and we said, no, we think it's important to address that. Politics did come in the sense that we had to anticipate all kinds of politics that could erupt. How would provinces respond? How would various stakeholder groups respond? How would other countries respond? And we did correctly predict at the time this TTX was occurring, the US and the US manufacturers were assuring us that we could get vaccine supply from US factories, and that would not be a problem. As you all know, that turned out to be a problem, and our supply in the early phases all had to come from EU facilities. That was a political issue. That was a diplomatic issue, but there wasn't political pressure pressure on us as the designers to not talk about X or to talk about Y. Ben, I don't know if there's anything you want to add.
Yep, completely agree. And it's worth drawing that distinction. We can represent politics within the exercise by posing political challenges that might emerge, but that's distinct from saying we had a political direction telling it or guiding us towards a preferred solution because of the politics of it. So there was absolutely zero political knowledge, interference, or sort of direction into the exercise, but political issues were nonetheless sort of captured.
Thank you so much for those responses. I'll go to the next question from. I also had a similar thought listening to your presentation. So interesting to see misinformation as a factor back in November 2020. Is that a common red team factor with issues that involve the public, or was this a response to observations?
I think I'll take that one sort of first. So this is an area which within Defence Research Development Canada, we do have researchers looking at sort of broader issues about how narratives are built sort of through social media and other sort of media forms over time. So this is a real issue that shapes much that we do as a society. So we thought it important to introduce, to allow people to talk about what happens if messaging got out of control. So it's very, very easy for the government to say, well, we have the daily press brief, therefore we're in charge of the agenda and we're in charge of what's been stated. But you're not. It doesn't work that way. Other people maybe benignly or maybe with ill intent, distorting messages, distorting opinion, and that is a very real problem. If the vaccines arrived successfully in all the distribution centres and everybody said, no, I've read on the internet that it'll kill me and means I can't have any babies, or that my whatever, I'll be sick forever if I touch the vaccine, which is going to implant me with radio trackers. If everybody believes that because they've read it on the internet, then nobody's going to take a vaccine, and the logistics rollout is irrelevant. So the public perception and the way the sort of the social media narratives played out was something we thought was an important aspect we needed to consider.
And I just add that I think one of the things that came out of the TTX was that everything had a public information and messaging component. It wasn't just misinformation. It was that virtually every contingency and every response, you had to think carefully about how to frame it so that the effects would be positive and not adverse.
Thank you. So a follow-up to that topic, to that question, also from so how closely did the original red team assessment of misinformation match up with our current perceptions of its impact?
I would say the TTX had a bigger problem with misinformation than we had during the time frame that we covered. But that's partly because we were amping up the challenge, right? There's no point having people come to a TTX and respond to mild irritants. You want larger spokes in the wheel. So I think that if you look at the rate of vaccine take-up in Canada, I think that we threw at them problems which are bigger than the ones we encountered for the first 2 doses. We could have a broader discussion on boosters because, as you may have seen on our previous slide, Canada's booster take-up is not as good as, say, European counterparts, and that has a significant degree to do with the information environment, but that was well beyond the time frame that we were dealing with at this point.
It's worth reflecting as well that what we were looking at here is concluding by having the Public Health Agency of Canada as the lead federal agency in discussion with people at other levels, is it allowed the room almost to have this sort of aha moment, because if it turned out that the provincial messaging and the federal messaging was at variance, not aligned, then you get the, well, look, one level of government says one thing, the other level of government has said something a bit different. Clearly they don't know what they're doing, so we won't believe either of them. We'll just believe sort of Fred on Google. Because the governments clearly aren't lined up. So it made it very, very clear that the alignment of messaging and coordination of messaging at all levels of government and across all agencies within government was actually a very important thing to bear in mind.
Thank you. Okay, moving on from these a few questions on sort of the political aspects and kind of messaging with the public, misinformation, to a question around workforce capacity. So from did the lack of qualified staff to administer vaccines come up during the exercise? Many public health units struggled with hiring from the healthcare pool of employees.
And the short answer is to that is yes. That certainly in the TTX sections, there were discussions of would we be able to put this volume of vaccine into arms quickly enough. It wasn't a major focus because the primary client here was FAC. It wasn't provinces and territories, but it certainly came up in the discussions.
The next question I'll pose, there's a few related to kind of planning and future applications, so I'll sort of bundle those together, but I'll go to a question related to ethics and values from so were there any perspectives who were not included in the red team or in the tabletop that in retrospect should have been included, particularly related to ensuring fairness and equity in vaccine distribution?
I'll have a first stab at that, and Ben can add. I think we had a fairly diverse red team. That was somewhat luck, somewhat having diverse professional networks. That was somewhat deliberate, and we were trying to get people from a variety of professional backgrounds. Some of those people work specifically on public health to marginalized communities, and those issues were in there. One of the contingencies in the TTX revolved precisely around a marginalized group not feeling they had sufficient access to vaccine coverage. We had less control over who was at the TTX because it just became this snowballing of invitations going out and being forwarded to other people and being forwarded to other people. I think it was a pretty diverse group and in terms of positionality, in terms of professional expertise, in terms of working in a big province with a lot of resources or working in the Northern Territory and so forth. But that was luck. I mean, we couldn't really control who was coming at that point. But Ben, I don't know if you have thoughts on this issue.
I'll just sort of to reiterate the issue that we had who we had. People eventually sort of self-nominated to be part of the main TTX sessions. The red team was perhaps invited by ourselves through people we already knew, and this was all driven by the timelines. If we had had a sort of set 6 months to design and create, then you might have sort of come up with a different approach to find the kind of people you want. But given the timelines, there was no way we were going to be able to do that. But again, I'd reiterate, as Rex said, we had a very diverse group of people from all sorts of communities, all sorts of functions, all sorts of every part of the country. We were literally coast to coast to coast in coverage.
I will add one other thing, and here I've grabbed my little Derby House Principles pin. It has become an emerging professional standard in defense wargaming that you want to encourage diversity and inclusion and marginalized voices, something you might not associate with defense planning, but amongst those who design serious games in the national security space, it's become pretty much a professional standard.
Okay, also related to sort of who was involved in the work, a comment and question from, I come from the perspective of emergency management. I'm curious to know how the Ministry of Public Safety and Emergency Preparedness were involved, and of the participants, how many were emergency managers, how many academia, just a sense of who was involved.
So for public safety, they were certainly present. They would have been in the other federal departments and agencies group, and there were a few, but I suspect it's in the sort of the 2 or 3 kind of level of people who are involved in there. In terms of sort of, yeah, so that sort of covers that one, I think. And the second question.
Well, we did have someone a former public safety official in the red teaming too.
Yes, we did.
As well, plus people who were related to public safety and that they'd worked in RCMP or what have you. So, plus my son works in public safety and he volunteered some research time too. So.
One of the angles that I was also thinking of, just to sort of sneak in a question of mine as part of this, was the building of relationships to facilitate the vaccine rollout part of one of the goals for this exercise? Like, were you bringing together new groups of people who were going to have to work together through that stage, or how did that play into your objective?
So that's really interesting. I mean, that was not our initial charge. Our initial charge was, here's the draft plan, try to break it, and then work out how you'd fix the things that were broken. In fact, it was even less clear than that, but that's pretty much how we understood our draft charge. I think a lot of networking occurred in the TTX, and it was fascinating to hear, officials from Quebec or Ontario or BC talking about what happens if the IT system gets brought down by hostile outside actors, and have people in the provincials and the territories talk about, well, we are in a much more austere IT environment. This is what we do to back up our vaccination records and this kind of. So there was some really interesting discussions that occurred there, and people certainly did exchange contact information. We could have done more to anticipate that. We didn't, because in many ways it was going to be a FAC exercise with provincial and territorial and other government department observers, and then it became 3 or 4 times larger than we initially intended. So going back, that was one of the things I think we would have wanted to build in more systematically than the way it actually occurred.
Yeah, I'd agree. It was a fortuitous sort of spin-off, unforeseen benefit. And I'd agree with Rex. I also witnessed sort of a number of interesting conversations going on as people, because we always think about the province to federal level relationship as being sort of needing to be managed, but in fact the province to province discussions were happening as well, and there was genuine sharing and a collaborative spirit between sort of the parallel sort of public health sort of agencies and ministries across the provinces and territories, as well as engaging with their federal sort of counterparts.
Yeah, sorry, but I was just going to say that one of the FAC officials we interviewed explicitly identified that as a benefit, that they'd seen unparalleled levels of province to province or province to territory or province to First Nation cooperation, and they thought the TTX had contributed to that.
Thank you so much. Okay, so we have about 10 minutes left, and we have a couple questions that relate to sort of like thinking forward and using such techniques towards emergency planning for public health emergencies in the future. So if we can spend a few minutes on that, I think that is really a topical thing to discuss at this time as we sort of consider other emergencies other than just COVID. So a question, while COVID has been exceptional in many ways, how do we better use this approach for planning responses to the range of emergencies that public health could be faced with in the future?
It's a good question. And I think, as I said in the main presentation, there's a standard sort of military planning process that exists, which military officers are all trained early in their careers to follow, which basically means sort of collect the facts, figure out what you're going to do, make sure you know what the objective is, and then test what you've come up with before you move anything. And that, in its essence, is entirely portable to many other fields. But having that and then test it before you do anything is important. There are different ways of doing it. That kind of test you can have computer-based simulations testing that the mechanics of things work. But a game allows people get emotionally involved, committed in some kind of simulated environment, and at that point their creativity is different. Is somehow sort of tends to be enhanced, and they can sort of see things, and the synergistic sort of bouncing of ideas you can create in a way that just looking at the plan on a PowerPoint form just doesn't do. So I think there's a great potential for this kind of exercise. There's nothing particular in the design of this exercise that's specific to vaccines or to a pandemic or to COVID. That design could be moved to other sorts of public health or public safety sort of issues and used. And these things are scalable between a sort of small group trying to look at something vice a much larger exercise as the one we ended up, which, as Rex said, turned out to be sort of 3 to 4 times the size we thought we were going to get. So there's certainly potential. One of the challenges is sometimes the terminology. The word wargame is a bit of a trigger sort of word to some people. Even in defense, people say, well, you shouldn't. The military is the professional arms is very serious, and you shouldn't turn it into a game. And then there are people doing other things that are not involved with military combat who said, well, war games are about death rays and battleships and things, and that's not what we do. And they're both perfectly correct and reasonable points of view. So sometimes you can call this an interactive simulation, and it will be exactly the same thing. So the labeling can be important, and people should, but making sure that what you do is approachable and inclusive and doesn't intimidate or deter people because they're afraid of what it sounds like being. So in the design, it's absolutely critical to make sure that the cognitive loading you place upon your participants is carefully managed. You don't bury them in details. You don't force them to do things that are very difficult. You don't put them in positions that they're uncomfortable in any form. Challenge them, but don't make them uncomfortable. So yes, there's certainly great potential, and Rex, I'm sure, will.
Yeah, I happened to be working in January 2020, just before COVID hit. I was working with Agriculture Canada on their possible response to African swine fever, which, if you're a pig, is far worse than COVID. I mean, 95% infection fatality rate, infectious in soil for months afterwards or weeks to months afterwards, may have resulted in the death of 1/4 of the world's pigs due to culling in China. That's a lot of dead pigs, and $35 billion potential losses in Canada. So massive thing. And I came in and helped them design a game. It was more of a structured game. It's what we call a matrix game. So it was not just discussions, in order for them to run through their existing planning on what they would do if there was an African swine fever outbreak in Canada. And they developed the in-house capacity to run the games themselves. They ran the game with people from Food Inspection Agency, from agricultural economists, from the broad range of people who've been working on parts of this issue. They ran it over and over again themselves. And they even the associate deputy minister came in and played at one point as an angry pig farmer, and watching her staff having their assumptions challenged by her swearing at them in the role of an angry Manitoba pig farmer was something to see. And it wasn't a replacement for their planning. They have done years of planning around a known pathogen, a known biosecurity threat, but it was just a chance for people to have discussions around the table, to see the perspective of other people, to get away from stovepiping. And I remember one discussion where we were talking about farm quarantines, and we were assessing the probability of farm quarantine to keep the pathogen on the farm. And the person who was the quarantine expert from Food Inspection Agency said it was about a 1/3 chance the pathogen will escape. And all the agricultural economists and policy planners said, how is that possible? There's a quarantine. And they said, well, quarantine law only applies to agricultural produce. It doesn't stop the 15-year-old in the farm hopping on the ATV, driving through the muddy pig field and going to see his girlfriend. That's entirely legal. We have no legal power. And it became evident at that point that many of the people working on it had not realized how loose our agricultural quarantine system is in terms of keeping a pathogen which can be spread by muddy boots or muddy truck tires on a farm. So it is a really useful technique that has lots of applications. It does not need to be complicated. Nothing we did here was complicated. I mean, there was a lot of work involved, but none of it was complicated. There are resources, I see another question, there are resources on red teaming and so forth. And if people want to contact us by email, we can suggest some of them. But I have to say, in many cases, it's just best to think, what is my problem? Who is my group that I want to think about it? How much time do I have for them to think about it? And then design the technique around that. So it could be simple as a red teaming process, which is just really a meeting where people are encouraged to poke holes in a plan, or a more complicated TTX, so you can develop more complicated games and so on and so forth. And I like to think of it as a kind of intellectual cross-training. I mean, it's not the planning, it's just a way of exercising different intellectual muscles and thinking about a problem, coming at it from a different angle. And the simpler you can make it, the faster and easier you can make it, the more likely you are to use it.
Thank you. Yeah, because we do have a couple questions around sort of resources and software that might be used. So thank you for offering to be contacted if people would like some specific resources, but very helpful to have that framing that you indicate where it is just kind of about also about the mindset and way of thinking that can be applied to planning and simulation as part of testing your plan. Okay, so I think with that, just want to, I think we can close. That's sort of the last group of questions, and just want to thank you both so much for presenting today. Really fascinating, really relevant as we kind of go forward to continue to respond to COVID and its challenges, as well as the many other risks that we're facing related to health impacts from other health hazards. So I would like to thank everyone who joined us for today's session. It's great to see such strong virtual participation during such a challenging time for our workforce. You can expect to receive the brief and anonymous PHO Rounds survey for today's session, so please try to complete this to help us improve our programming. And lastly, to access past PHO Rounds presentations and view confirmed upcoming sessions, please visit the PHO website, head to Education and Events and click on Presentations. And with that, just want to thank you again to our speakers and audience and wish you a wonderful rest of your day.